Well, welcome back. If you're joining us, you're watching Channel 1 News Hour. It's time for us now to have our discussion on your health. And this evening, we're looking at reproductive health care. And specifically, we will be focusing on what not very many people talk about, or not really much information is out there regarding a condition that is known as endometriosis. And for more insights, I'm now joined by Dr. Charles Muteshi, who is an endometriosis and fertility specialist. Thank you for joining us this evening.
Thank you very much for having me.
Just even pronouncing the word is difficult. But let's talk about, reproductive health care with the bias towards fertility issues.
Yes.
In terms of statistics, what would you say are the numbers when it comes to infertility, particularly in Kenya?
The numbers are kind of general. We know about 1 in 6 couples who've been together for longer than a year will struggle to get pregnant. The statistics shift a little more towards unmet need because access to fertility is not available, particularly in this part of the world. So the causes could be due to female factors or male factors, or sometimes a combination of both.
But are people willing to speak about fertility issues because it's always considered taboo?
It's a private matter, but you kind of people talk about it indirectly by asking you, when are the children coming? You come to parties and when is it happening? So it causes that discomfort, and eventually many would turn up to the doctor and say, we think there might be something that's not right.
Is it that there is an increase in fertility issues today as opposed to before, or is it that people are now more exposed and willing to talk about it?
It does change a lot with demographics. So in the 80s, 90s, we predominantly thought sexually transmitted infections caused damage to tubes, both in men and women.
Yeah.
And now we know that things like lifestyle, which contribute a lot to conditions like polycystic ovary syndrome, which causes lack of ovulation, is more talked about. And we also know that because of career aspirations, people are waiting longer before they can settle down to children, and that can also contribute to it.
What about the use or misuse of, what do you call, misuse or use of, what's the name, contraceptives?
Contraceptives are meant to pause fertility, or they temporarily allow you to do other things without the risk of being pregnant. But they are reversible, so they do not contribute to subfertility. So it's not a factor in... It wouldn't be. It wouldn't be.
No. All right, let's now focus on what our discussion is about today, endometriosis. What really is this condition? What does it affect?
It predominantly affects women in their reproductive age, and this means women who are menstruating. Generally, the presentation would be with pelvic pain, because it's a condition that is concentrated around the female reproductive organs. Specifically, we know that what endometriosis stands for is the tissue which is very similar to the lining of the womb that sheds every month with a period. So you might find there is endometriosis in the pelvis, around the fallopian tubes, around the ovaries, structures that attach the uterus to neighboring organs, such as the bowel, bladder. And very occasionally, we find it in distant organs, for example, the brain, the lungs, and even the skin. So it's not just a reproductive kind of problem for it to get to the brain? It has got a lot of reproductive characteristics because it's hormone-driven and responsive to the female hormones, particularly estrogen, which is a hormone produced by the ovaries during the reproductive years. In essence, we think 98% of times it's concentrated around the pelvis or reproductive organs. So what we refer to as extrapelvic endometriosis will be rare, but it's recognized. It's recognized. So how does it represent? Mainly, you wouldn't have any specific symptoms that you think, oh, this is endometriosis, just by how you feel. However, majority of girls will have menstrual cramps and period pains that are quite severe. Sometimes the pain may be excruciating, but the degree of pain does not necessarily represent the amount of endometriosis present. Pain can be cyclic, meaning that it comes every time you have a period, but occasionally it might change character and you have either pain in the middle of the cycle, pain throughout the cycle, or with other activities such as moving your bowels, emptying your bladder, or when you get intimate with the partner. There are cases where endometriosis is discovered when we are looking for causes of subfertility. So it's recognized to be a contributor to delayed conception.
Perhaps in terms of age, is there a specific age where perhaps people begin to exhibit some of the symptoms, or people are vulnerable to endometriosis? Because we've talked about girls. Is there a specific age we are looking at?
Yes, so the tragedy about endometriosis, it takes a long time before it's discovered, and predominantly girls in their 20s to 30s would be diagnosed with endometriosis, but we do know young girls as in their teenage ages will have endometriosis because pain would have started when periods begin. So there is no specific age except during the reproductive ages.
All right, so how do you, in terms of the causes, is there anything particular that you have been able to tie to what causes this condition?
We've been able to kind of look at associations, so it's not necessarily causes, and basically looking at communities, lifestyles, and things. There is a strong association between family members. When someone is diagnosed with endometriosis, there is a possibility there will be a family member who will have endometriosis as well, or symptoms similar to those. We also know that very short cycles with very heavy flow predispose women to endometriosis. On the contrary, girls who have a low BMI may have a higher risk of endometriosis for unknown reasons.
So then what is considered, perhaps a normal period for someone to be able to know what to look out for? Because you've talked about pain, talked about the length of time and the heavy flow.
A normal period does vary a lot, but on average it's about 24 to about 32 days, and a flow of up to 7 days. So anything longer than that or heavier than that would be abnormal. Pain is not a character of normal period, so any amount of pain should raise concern, and perhaps girls should be able to say, well, I don't feel very well when I have my period. Can I see a doctor?
Is there more awareness in terms of people going to visit, fertility specialists or just a gyna?
There seems to be an awful lot of delay before presentation, and there is also a second barrier of delay that girls and women come to doctors and they may not suspect endometriosis at the first instance. It takes about 10 years to make a diagnosis, unfortunately.
That is a long time.
It is.
So in the event that perhaps you're diagnosed with endometriosis, what next?
Depends on the symptoms, your age, and what you prioritize to be the most bothersome of those symptoms. So young girls who are in high school, for example, would really want to concentrate on their studies, and heavy painful periods such a distractor. So we would want to make them comfortable by giving them something that can relieve the flow of the period and the period pain. And depending on the extent of endometriosis, because we have degrees of endometriosis which could also be predicted from examinations such as ultrasound scan or MRI, which are special tests we do. If we don't think it's very extensive to involve the bowel, the ureter, which is the tube that connects the kidneys to the bladder, bringing down urine, and is not causing any obstruction to those acutely, then we may manage those symptoms conservatively. There is a place for surgery, and ideally you would want to be in a center that is able to diagnose appropriately and treat at the same time. And we now use something called laparoscopic surgery, which is a keyhole type of operation, where we use a special telescope through the belly button and the navel, have a look at the pelvis, and when we identify endometriosis, then we will take away those lesions. Is something we call excision surgery. If the surgeon is not very comfortable, then it's best to refer to an appropriately trained specialist, because endometriosis does sit on vital structures such as the bowel, the bladder, so you wouldn't just be cutting away when you know that you could damage other structures.
So how many specialists are there in this country, if indeed you have to go explore that treatment option?
Medical practice is growing, and I think year on year we are seeing more people getting interested in specialties, and I would say that we've got quite a few people now who are comfortable.
Or do you have a specific number?
I wouldn't have a specific number, unfortunately, no.
What about access in terms of which hospitals, where can we be able to access a treatment?
It depends on the setup in your locality and whether you would have a specialist in that area. The first thing would be suspecting that you possibly have endometriosis, and the right treatment is offered to you.
How long does the treatment take? Is there a time frame to it?
So endometriosis can be an evolving condition and sometimes quite debilitating, which means that when a diagnosis is made, a careful consideration of a plan over the long run is made between the patient and the doctor. So as I mentioned earlier, young girls may have pain, middle-aged women may have struggles with fertility, and there are also concerns around the menopause which have to be considered. So this is a plan that is supposed to be laid down and very clearly followed. Now, it doesn't always fall in place, and certain treatments may not agree with you, and you may need to change course along the way. It's also a condition that we've now realized that cannot be managed by one person. So it's best that you are in a center that collaborates between different specialties. For example, you might have bowel symptoms that require a bowel surgeon or a specialist. You might have psychological problems that come with this, so you need that type of support. And it does affect livelihoods, and even people have lost jobs, so you need that kind of social support structures.
Given the complexities that you're talking about that are associated with this disease, it brings us back to the question of the cost. How cheap or expensive is it to treat this condition?
It depends with the approach, and one of the unfortunate things is that suboptimal treatment can make the condition very expensive to manage. Because if you have surgery that does not take away the whole disease burden, then it means your symptoms may continue, and you may require multiple surgeries, of course, with the attendant risks. If you need to be on hormone treatment, some of them are quite expensive, but commonly we use contraceptive pills which are used by women, and they serve a dual purpose. For example, preventing a pregnancy, which you might take for ages if they agree with you and you are not in immediate need for conception.
In the best scenario, would you be able to put a figure of between how much, and also in the worst case scenario, what we are looking at, for us to appreciate the numbers?
We have figures that have been derived in Western countries, so I wouldn't know what it would cost somebody locally here because we haven't done those studies yet. But it costs a lot of money, in billions of dollars, to manage endometriosis, and that's not just in medication costs, it's also in time of work, and other issues.
All right. If you go through treatment, are you able to bear children after that?
Absolutely. We do know that endometriosis can affect the chance of getting pregnant, but there's very good data that shows, depending on the stage of disease, early stage disease, if it's removed surgically, improves the chance of getting pregnant quite significantly. If it's far much advanced, then we may have other options to fertility aspirations, for example, in vitro fertilization or what we call IVF. It's not accessible to everybody, but there are also different ways in which we do IVF, something like low-cost IVF or minimal stimulation and approaches.
Are there any complications that are associated with the treatment?
Yes, and especially when it comes to surgery. We have to balance very carefully the desire to remove the disease wholly and where we actually are picking it up from. So if you have bowel endometriosis, you require a specialist who is very, very careful in ensuring that they are able to spare the bowel without putting you at high risk of bowel damage. If endometriosis on the ureter, for example, then it's a very, very delicate structure, because then if you are going to remove it, just by the fact that you are touching and manipulating it, that can put the ureter at risk.
In the recovery stage, are there any specific do's and don'ts that you need to follow as someone who is in recovery?
On the contrary, not necessarily, because just like any other operation, we would like people to pick up themselves very quickly and go back to their normal lives. So in fact, now we talk about the concept of enhanced recovery. We prepare you very optimally. You come to surgery, you start moving about very soon, you feed, you go home. After laparoscopic surgery, you might stay in hospital maybe for a day or two, and you're back to work in a couple of weeks.
I've actually asked that because you had mentioned the issue about lifestyle is one of the issues that are associated with this. So is there anything in terms of how one needs to change their lifestyle to be able to protect themselves against some of these fertility issues?
Infertility has got several causes, but tragically we know tumor damage or infections that come from sexually transmitted infections can increase the risk. So we do advise always that be careful, use protection, and obviously test early and treat. Smoking does affect the chance of conception, so anyone who is a smoker, we would say that could potentially affect your fertility prospects. And of course, weight has a significant bearing.
All right, I'm informed our time is up, but I'll just give you a moment to look into the camera and just speak to the women out there in terms of what is it that they need to do to be able to get tested, diagnosed early to prevent themselves from perhaps getting to the last stages.
What I can say is that women need to know that there is a lot of hope. Most people are now talking about endometriosis. There is a lot of awareness, and I think tremendously there is support through Endometriosis Association. And access to doctors is now available. You may reach a friend or somebody in the association who will link you up to the right people.
Okay. Thank you very much. Unfortunately, our time is up, but we appreciate you giving us insights on what really this condition is and what are the options available for women who find themselves struggling with this particular condition and they don't know where to get help.
Thank you very much for having me.
Well, we'll be talking to Dr. Charles Muteshi, who is an endometriosis and fertility specialist, putting into perspective some of the available treatment options and also just trying to shed light on this particular condition and the need for women to try and just understand what are some of the symptoms and how you can be able to get help. It's time for us to put a cap on this program, but of course, business news is up next with Betty Kiptum.